All right, so let me begin then with the panel. I will start with Dr. Poonam. Uh, and Dr. Poonam, to begin with, she is the Senior Migration Health Policy Advisor of the International Organization for Migration in Geneva. She's at the headquarters itself, and most of her task is to advise member states and partners on actionable migration health policies that are aligned with leading global health strategies as well as migration management principles and priorities. So, Dr. Poonam, if there's any time to have a discussion on health and issues around health and services on migration, now is not, there is no better time than now. The world has been practically shut down by a global pandemic. And so it's good that we are reflecting on Objective 15 and what it means for migrant workers. And I guess the big question that has been floating in the migrant communities, in countries of origin, in countries of destination, is how can you ensure equitable, safe access to health services for migrant workers? How does the Objective 15 actually spell that out? If you could respond to that.
Thank you, William, and thank you to the colleagues organizing and co-organizing these webinar series. Happy to be part of number 15 today. So yes, in terms of how Objective 15 addresses equitable and safe access to health services, I would say for migrants overall, not specifically only migrant workers, although of course a large proportion of international migrants are migrant workers, as we well know. So as you pointed out already, GCM 15, the Objective 15 addresses services, of course, across a wide range. So you have health, education, you have social services, integration, etc. In terms of health, I would say the first key point is to bear in mind how the GCM actually is coherent with other key global health policy frameworks. We have the Global Action Plan on promoting health of refugees and migrants that member states have explicitly recognized also in Objective 15. And what does this mean in actual practical policy terms? It essentially means an effort for progressive realization and incremental inclusion of migrants, regardless of status, in national health plans. And it also means that national migration plans or policies and frameworks, for example, for labor migrants, are inclusive of addressing equitable access to health services. So we have seen some movements in the right direction, both during GCM negotiations and of course since conclusion thereof. For instance, in countries like Nepal, which has actually adopted now a strategic action plan on migration health, which seeks to make a more coherent approach across the different ministries and government towards migration health, as well as a Myanmar migrant health policy framework that was adopted in that country, again, trying to look at migrant inclusive health services and programs. Further to that, of course, there are many efforts by IOM, say as the UN Migration Agency, working closely with partners like WHO who are here with us today, as well as others, especially when it comes to access to services for those migrants who may be marginalized or in vulnerable situations, migrants in irregular status, stranded migrants, which unfortunately a lot of our migrant workers around the world have found themselves in a situation of, even with the pandemic, and how there can be targeted programs that complement government efforts in order to bring access to services, whether through mobile primary healthcare clinics or via intensive, culturally appropriate health promotion and education, which enables the uptake of basic services, if you will. So I'll stop here in terms of a brief 2 to 3 minute reaction to your question, William, and happy to continue to engage with the participants. Over.
Thank you, Dr. Poonam. And it is, and I agree with you that the objective does spell out what could possibly be done. Uh, but just to be clear as well, that what are the can you see how realistic is this in the terms of that it is happening? Because one of the challenges in this pandemic has been precisely that, is that access to services, and particularly health services, and particularly to migrants, irrespective of status, was varied, to say the least, in most destination countries. Uh, so how can the objective 15, aside from being this where the language, how can it be actually translated, really implemented on the ground? What weight does it have in making sure migrants have that access?
So, in terms of the weight that the weight that one particular objective has, I would say is, of course, the same as the weight to all the objectives of the GCM. The GCM essentially making an effort to indeed have that 360-degree view in terms of policies related to migration and directly affecting migration. So, yes, if you're speaking of the COVID 19 response related efforts, we have seen that several national preparedness plans and several outbreak response plans in countries or even at local level have found that not having included migrants has been a limitation because there was not that contingency, there was not that preparedness to ensure that outbreak related outreach, education, access, be it to testing, be it to being able to access the right information, has been challenging because we have seen through previous studies as well that in many countries, migrants were actually not formally part of national preparedness and response plans. I would say that the objective, clearly making a link with the Global Action Plan for promoting health of refugees and migrants, does provide an entire menu, if you will, of practical actions that can be taken, and some of which have been taken in some member states during COVID. For instance, some of us are well aware of how Portugal has been making sure that even those who are still in process of getting regularized in terms of their migrant status had same and equitable access as citizens to COVID related testing and care. Similarly, free universal COVID 19 services have been provided. We see some good examples even in the recently launched State of UHC report, where countries like Turkey, like Singapore, for instance, vis-a-vis migrant workers, have at minimum put in place measures, albeit temporary. And in some ways, this will be an opportunity as well for all of us working either at local, government, or UN level globally to continue this advocacy that some of these measures that are temporarily in place for migrant inclusion indeed become more permanent going forward, not only for GCM Objective 15, but keep in mind, most countries are committed to SDG 3.8. They have UHC commitments, as we've seen in the recent State of UHC report. And including migrants will only enable countries move forward towards achieving their SDG commitments as well. Over.
Yes, and thank you for that. And I'm so glad you brought out the SDGs, because Definitely, I think while there is still some traction to be built around the GCM and its implementation, it's very still very young kind of thing. It's only 2 years and 1 year since its adoption, and 1 year has practically gone in a lockdown kind of thing. The SDGs are there to kind of guide this whole notion, and I'll come back to you on this, but in terms of what you have said, the need for an advocacy for this guidelines to become real, but it also therefore means then that somewhere that public health services, more resources will have to be put into public health services kind of thing, in terms of even reaching this goal like the SDGs kind of indicate. Um how are we going to is that one of the biggest learnings we have seen, that public health services have suffered over time because of the economic paradigm that we currently kind of have? Will this be one of the big learnings of the COVID, that we have to prop up the public health services? And what is the role of the UN and IOM in making a case for this as well? I'll come back to you on that to give you a thought as I give to give you time to think about that.